And here it is one of the popular ones in the late decades, maybe since the 60s in China. And well, we have been using this acupotomology or knife needle technique in different situations, incorporated into the practice of medical acupuncture. Are you seeing my presentation is okay? It's been shared properly?
Yes, it is wonderful.
Okay, good, good. Okay. Well, here it is. I'll try to make it as simple as possible. I have some video clips demonstrating, but here I will do this, all these steps for these parts of my presentation, as you will see. I think I have about an hour, which is plenty of time. I will try not to run. Many times I start very slowly, speaking very gentle, very clear, but then I don't know what happens. Then the motor engine goes to turbo and I start speaking so fast. Please, if you feel like I'm going so fast, Constantina, just let me know and I will slow down a little bit. Okay? Well, then here's the concept. This technique, I'm not going to go into the history or other explanations will take a lot of time. So I will try to make it as simple as possible, but as clear as possible also that you will, at least from this presentation, this kind of online workshop, you will be tempted to study it, to practice it. I don't believe it is that complicated. You have to have special training. You have to be a physician. You have to know anatomy and other things, of course, in order to do a proper use of this technique and not to harm the patient. In one way or the other, if we consider needling to be a little bit invasive in one way or the other, this technique with this special needle is a little bit more aggressive. That's why in many cases we prefer to use a local anesthesia. But I have to tell you, even you will see it later on, the materials that we use to perform the technique. In China, many times this technique is performed without any local anesthesia. So it's not that invasive. And if you have a very high threshold patient with a very high pain threshold, then it could be. Even I've done it on myself and in some of my friends without any anesthesia, and it's real quick. You don't have to really stand severe pain. It's not that aggressive. The needle, you will see it. You will see the type of needle and how I've been using it in the video clips I will show today. But anyway, it is a little more aggressive. It is a knife needle. Sometimes it sounds a little bit aggressive just from the simple title of knife needle. But okay, we will use acutomo, which is more closely to an acupuncture needle. So the main thing of this technique, which is being showed in this slide, is that it is intended for chronic diseases, for chronic, well, soft tissue injuries that is mainly related to the musculoskeletal system, even though we could still consider this type of needle an instrument to stimulate acupuncture points and also to get a good therapeutic effect. It's like when you do fire needle or when you do a very aggressive manipulation with a regular needle, you could create kind of trauma which we release several substances and all the mechanisms that we know of the effect of acupuncture in the body could be created with this type of needle as well. So even you could tell that if you are intending to break up the fibrosis, the additions on several tissues, not only on the on the joints or the muscles or the ligaments or musculoskeletal tissues. You could also, if you find certain spots, knots, or places where you could uh, show that there is some kind of a blockage or blood stagnation, let's say that we could use also this technique. But as you will see today, the pathologies where we usually use it, they are very common in a medical acupuncture practice. They are very common in a clinic in general. In our daily life today, we do encounter several times that we have these kind of patients. The patient that you will see today have been chosen for specific reasons. But many of these circumstances, these pathologies, could be treated with other techniques, of course, for acupuncture, for with microsystems. And as you saw today, now just with Marcia's presentation, there are different things that you have to do with your patient at the clinic to solve the patient's suffering from the acute pain, and just to let him go real quick to continue his daily life, and then probably later on come back for a more overall comprehensive integrative treatment with acupuncture. But then, of course, this technique should be chosen for the certain specific cases. And I will, on my final remarks or conclusions, I will stress a little bit more on that. But just remember that we have to find a type of fibrosis where there is not only the limitation of movement and pain, but you could actually palpate and create some clear response in the body while you are exploring the affected area. Of course, the patient many times has come to the clinic already with a lot of previous treatments, or even with acupuncture. Many times I select these types of patients after they have come to acupuncture treatment several times, and the response has not been as clear as I was expecting. So I decided, okay, let's do it. I think that I will do the best. I will improve the response. It will make it faster and much clearer. And it happens when I select a patient to do this type of technique. I go like with the 100% of certainty that it will be effective. So that's a very important thing. When to use it, how to select the appropriate patient. Okay. Well, so this was the introduction, the general overall, but I will show some of the things that will support what we do with this type of technique. And as you will see when I describe some of the things that I will be describing, it happens for the practice of any other techniques. Even if the patient it's intended to go through a more severe, more aggressive type of treatment like surgery, well, we have to know what is going on in the body. But this is to explain in one way or the other that that knowing this anatomy of this pathophysiology of this type of conditions or pathologies is very important to understand why the use of this type of technique can help. Okay, so I'm going to repeat all the biomechanics or all things, but it is a condition that the patient comes for limitation of movement, comes with pain, with swelling, with a clear, real limitation on his daily life that needs to be solved. So here is the how the pathophysiology of the chronic injury behaves in the body. How it is a persistent inflammation which is dysregulated the body's systems that response. Actually, the body in himself starts creating a kind of a vicious cycle that promotes more and more tissue damage. And at the end, the microcirculation, which in Chinese medicine or in Western modern medicine, we know that there is ischemia, there is affection of the microcirculation that at the end will damage the tissues itself. It does not necessarily need to have a trauma or a kind of accident that creates certain immediate acute blockage. Most of the conditions that we see in our daily practice of acupuncture are related or to the use, the bad use, overuse, trauma, of course, and aging. In several ways, we could consider that even just aging, the aging process, is a process of the tissue is being creating certain kind of deterioration and the microcirculation lowers and it decreases and becomes more and more slow, and then a kind of blood stagnation is occurring slowly, gradually, slowly by slowly every year. So we And in the elder we can expect much more conditions where there is fibrosis and blood stagnation that we need to do certain types of treatments. We could use herbal medicine, of course. Of course, in Western medicine, there are several other approaches with anti-inflammatory, anticoagulant, and other things that will probably alleviate, but with creating a lot of side effects and other complications that we do not want to have. So doing this kind of type of practice with acupuncture or these related techniques, we intend to create, even though it looks severe, aggressive, and traumatic in one way or the other, the technique, it is much, much less invasive and damaging and having very little or no side effects. So as we know, as I was saying, that for not only in order to understand the mechanism of an injury, and that will put a patient in a condition where he will need attention, and that we all know that acupuncture is a very good approach, very good solution, very good profession, and but not only to treat this kind of thing, but I have to tell you that if we are talking about incorrect postures that could create a lot of conditions in our body, in neck, in the lower back, in the knees, in the shoulders. But then our daily practice as acupuncturist, it depends on a posture to insert the needles, to have the neck bending down, and to facing the body of of the patient. And we do not have the appropriate posture, never. Or, well, we don't learn easily. And sometimes you have to learn after you experience yourself that kind of condition, that kind of trauma in your neck mainly. Of course, the use of the cellular phones and the computer itself also create a bad posture that at the end will cause some kind of injury in different uh, joints and sides of the body. So here we have the typical things. And we could also describe this how these mechanisms are behaving, how how the external things that how these uh, continuously create a kind of mechanism, of course, that is described here, to at the end will create a malfunctioning and will promote the response of the body in various ways, as here I say in the intrinsic mechanisms, releasing inflammatory substances, the changes in the cellular, in the tissue, how the collagen, the tissue of the collagen, becomes altered, the proper repairing of the body. So there is a normal kind of repair that at the end will create more trouble, will create kind of scarring, or that as we are saying all the time, is the adhesions and the different tissues, especially ligaments and muscles, and in the insertion of the ligaments and muscles in the bone will create more and more blockage and limitation of circulation, fibrosis, limitation of movement, and pain. So, well, here's I try just to make it simple correlation with how in even this mechanism of the stress and oxidative stress, how the release of this the increased apoptosis, how the cellular response to the damage that has the damage associated molecular pattern and the external um, membrane, how it is altered through these kind of mechanisms, and will create a fibrosis, because there is, in one way or the other, the body not it tries to repair, it tries to regenerate, but it is a complete failure, and it ends up creating fibrosis. In Chinese medicine, or in the view of Chinese medicine, has had many ways to go to that type of site. I said inheritance, but aging is very important. The disruption of the spleen, stomach, liver system will create blockage in the channels, the pathogenic factors that we call the dampness that enters the body and affects the circulation of the channels and collaterals. At the end, will create stagnation, blood and energy stagnation, fibrosis, and pain. So here is the correlation that I could have, very simple, just to show that there is a condition where we need to repair, we need to break that blood stagnation. We need to release that blood stagnation. We need to release that fibrosis in one way or the other. And it's not as easy as just open the body and do a kind of extraction of that tissue and that's it. Actually, in surgery, especially in surgery for uh, cervical or lumbar herniated discs, the problem is not the type of surgery, the good of the skills of the surgeon, how good the surgeon it is. It could be the best surgeon in the world, and after opening and trying to repair the affected area, the disc, and to put some nails and platelets of different materials, will create a response in the body that will create more problem, the scarring, the fibrosis that will be created, which is very difficult to prevent. We never know how it's going to behave, the particular body. So for those kind of situations, there is no real clear solution. How do you go and you inject certain drug or you open and take out the fibrosis? It's not. So this technique that I will show today, it actually helps to break down, to open, to remove, to release that area of scarring or fibrosis without actually creating a stronger response from the body. It's very mild, very gentle. So it opens, it breaks up, it releases the blockage and the the limitations. And in one way or the other, we are breaking up the blood stagnation process, and then we recover the limitation. We relieve the pain of the patient. You will see it. And I wish you could practice this as is in a online Zoom demonstration. It's not that easy to see it, but I did my best. I even cut up some of the previous procedures or many of the precise preparations that we need to do for a particular treatment. But anyway, what you will see is actually very simple. It takes not much time. It does not need much preparation. But anyway, the effect of this chronic soft tissue injury is here. What I've been repeating time after time. The area uh, loses the elasticity, loses the capacity to move, to perform the normal movements. So it creates a lot of suffering, not only pain, but the limitation for movement in the daily life is very, very hard to take for the patients. They need to move. They have to continue doing exercise. Over that, in other way, will gain weight and will not be able to follow other activities which are good for health in general. So that's what we need to deal with this kind of a condition of fibrosis that, as we are telling, it is intended to go to the areas where the movement is created, where the joints are needed to have the flexibility, elasticity. So, but it involves block fibers, nerves, and will create pain related to the pressure of the certain nerve fibers that will create a radiation of pain to certain, like it happens in the lower back pain with a sciatic nerve involved. So we need to relieve those fibers, those muscles, those blood vessels, and other deeper structures as well. So anyway, the patient comes with uh, several areas of pain. You have to find out the areas and the trigger points which has been evolving from these particular damaged tissues. And of course, that in order to know perfectly the diagnosis, it is much. Uh, I mean, I don't want to say that it's needed always, because it depends on the type of damage, and depends on the patient, depends on the type of pathology. But many times you do not need actually to do this, to have the MRIs or the TC scan or even the ultrasound, which is the most easy one and less expensive. But anyway, through the clinical, you could tell how the limitation is coming in this particular tenosynovitis, in the trigger point condition. You have to palpate and you have to feel exactly where it is. You do not need to follow a directed intervention through the X-rays or ultrasound. You could do it right away on the clinic. You can palpate the region where you can feel actually the nodule, the induration, the rigidity, the fibrosis itself, the scarring itself. You can touch it, you can feel it. And not only that, you can feel it perfectly through your palpation, but also the patient will experience the pain, or you will be able to evaluate the type of limitation that has been created in that particular area. So, as I'm saying here, the post-surgical adhesions and previous scars are also a very important target many times. Um, you know that people go for surgery for lumbar herniation discs, and then they come back with, because they have persistent pain, and you discover that along the scar that has been created, you could palpate that kind of rigidity, the tension, the rigidness, the hardness of the tissue, and also pain on that local area. But even though without creating or provoking pain on that particular region, you could tell that there is more inside. And actually, what we do with this Acutum knife needle, we go and try to separate, to relieve some of that scarring. And just by doing that, even though you do not need to go to repair the disc, you do not need to go and directly press or irritate or relieve the nerve. Many times, just by relieving, by reducing the tension on the scar tissue, will be enough to restore the circulation, the relaxation of the tendons and the ligaments and the muscles. And from that, you will right away will have a very good therapeutic effect. Some of the frequent or main pathology that we see in the daily practice of acupuncture, and where many times even just by doing acupuncture, it could help them a lot, is not that these are the pathologies that will only be treated with good results doing acutomology. But as I said earlier, sometimes we've been doing treatments, regular treatments, and different techniques to this type of conditions, and the result is not as good or is not as fast. And then at certain point, you have to decide, okay, let's go for it. Let's go for the Akutom technique, and it works. So yeah, we have to evaluate, as I was saying earlier, and then we have to do all what we know as physicians. Of course, the better we have the diagnosis, the better we have the time to decide when to do these. With the most evidences that we have from what is going on, the better we are prepared to know the area, the anatomy, and everything, and the better we know we are good on doing this technique. But as I was saying, to you, it's not that you need a 1 year or 2 year training in order to perform it. You could just follow the procedure as it is, as you did with acupuncture, and it will be enough. Of course, you have to have the previous preparation, diagnosis, of course, the exploration, the palpation of the regional area. If you have ultrasound, it's also very good. Well, it just confirm diagnosis. Sometimes it helps you to localize much better where is the area that you have to go and treat. Many times you have to select either the insertion of the ligament or the ending of the ligament, the insertion of the ligament, the opposite side, the origin and the ending. And also you have to go sometimes on the middle of the area where you have to create the where you have to find the fibrosis, the limitations, and to release the fibers which are blocked and have a good result. So here it is. I'm gonna show the how the technique. First, I will give you overall technique, and I have some animated pictures, and then we will show the videos. Okay, well, here, well, just to show you the needle. I don't know. I think earlier there was a doctor who presented something about the Akutama. I think somebody from Korea. In Korea, I believe it's becoming also very, very popular, and they're also producing very good Akutamas. Actually, I have some of the Korean ones with me too, and I've been using them. They're very good too. But well, I've been most of my time I'd learned this in China, and I all my materials I bought them in China, and this has been an evolution also from a very thick Akutamas. So at the beginning, we were using I think it was like 0.80 and even 1 millimeter um, thick of the Akutamas, which was kind of aggressive, a little bit much more pain was created, and that's why many times when you needed to put some local anesthesia. But then now we do this what we call mini or micro acutoma, which is very thin. Sometimes it could go as thin as a regular acupuncture needle, as you see from zero point 0.3 up to 2 millimeters. But I barely use that. Most of the times I've been using from zero point 0.4. 0.5 is very common, especially in hands and smaller areas. And then up to zero point 0.8, maybe the maximum I've been using nowadays in the lumbar region, as you will see. And the length, as I will show today, I will be using a uh, one acton, which is more or less the same size as an acupuncture needle, that the middle one in this picture. And in the lower back, I will be using a longer one, like the first in the picture, in the upper part of the picture. So it has the cutting tip, which is actually as a scalpel. It is like a screwdriver, we could say also. So it has a very thin, sharp edge, which is the cutting tip, which is the main purpose of this technique, the knife needle. So here are some of the procedure, the steps that we do. We have to find a proper posture for the examination, and of course, not only for the examination to find the place where we're going to perform the technique, but also to have a comfortable position for the patient. It's not going to last too long. As you will see, it's less than 5 minutes probably. But anyway, it has to be in a good position. Also to help the physician to perform the technique. And then, well, we do identify where is the lesion by palpation, or of course, as since we know anatomy and we know where we are, where you're going to go, we have to palpate, locate the area where you're going to insert the acutamus. And many times, as you will see, you mark where is the place exactly where you're going to go with the acutamus. In certain places, it has to be very, very precise, as you will see in the hand, in the trigger finger. You cannot miss it. If you don't go exactly on the point, you would have no effect at all. So we prepare the material in advance. So here for teaching purposes in this presentation, I avoided to show all the steps or video recording all the procedure. I just went through the technique itself, but you can understand that there was a preparation in advance. So, well, we do a asepsia of the surgical field. actually surgical. I hate to say that, but well, it's kind of a microsurgery. There was a friend of that we met. He was practicing acupuncture back then also, and he actually was very afraid of doing acupuncture. He considered that acupuncture was in itself a kind of a septic procedure that you will need to perform it with gloves and with mask and all the antisepsia that is used for surgery, but it is not needed. As you will see, also I avoided certain things that usually we could have, like for after you do all this with this all this material, you sterilize the just with antiseptic like microdazing and you put gloves, of course. It's definitely needed. Sometimes even I can tell, but it's that fast and it's almost as a acupuncture needle technique. Yeah, in acupuncture, you many times you have bloodletting and even without the intention of letting the blood out, you have blood coming out. You just do some antisepsia, that regular procedure. There's no harm. Anyway, for these type of techniques, a little bit more aggressive, create a little bit more of a cut, you could say, but many times, as you will see in my demonstrations, there were no bleeding at all. So anyway, it you could even do it if you don't have sterilized gloves. Let me tell you, probably in certain countries will be forbidden and you will go into jail for malpractice, but actually it's very safe. So anyway, even I do this. We prepare a special kit. I thought I had a picture of that. A kit that has been sterilized previously with the Acutomus inside and with all the materials and even the gloves inside of this package, which comes with all the things that you need. And you have also a um, a cloth the surgical cloth to protect the area. So to have it as if you were really going to perform actual surgery. Anyway, you do the infiltration with the mepivacaine is the most popular one. It's very well accepted. It's very well tolerated. It has a very immediate effect. After you do the mepivacaine, it will probably you need at least not more than 5 minutes. Maybe you can leave it a little bit more, but not too more anyway, because it's very little the amount of local anesthesia that we use that we will vanish. So it's not it's going to last for hours. It's actually probably when the patient comes out of the clinic, the effect of the anesthesia has gone. Anyway, you use that. As I was telling you, you could do it without anesthesia. Certain areas, it is that fast, that simple that you do not need to really do the whole procedure of anesthesia if you don't want or if you don't have it. Okay, and when especially when you do this mini acutoma, the real thin one, 0.4 of diameter, is very mild. The sensation is not too painful. So when the release specific, when you release the fibrosis, when you release the constricted areas on the adhesions and fibrosis in the ligaments and muscles. So here is we first do after inserting the acutomus and go directly to the area. Then we're going to do the cutting movement, and you will see the cutting movement is that with the tip of the acutomus, you actually a cut. You will feel it clearly, very clearly that you are cutting very thin, but it is a cut. And even you could move the acutamus back and forth, following the direction of the fibers of in the ligament or muscles, as is shown in the picture and the motion demonstration I'm doing there. This maneuver can be performed several times, depending on how big or how hard is the tissue. But you will feel it. How through doing this simple procedure for a couple of seconds, sometimes you will feel how it is breaking the tissue, how it is breaking the scar, how it's being releasing, and actually the patient does not feel almost anything if you do with a local anesthesia. And definitely, you could not only feel it on your hand when you caught in the fibrosis, but also even the little sound that the patient even can hear it, how it's not that loud, but anyway, there is a sound coming up. Then we after doing the cutting procedure, then we do this non-cutting, which is a vertical movement, also following the lines. It's like we don't want to do a section of the ligament. We follow the direction of the fibers, and we do this balancing back and forth several times. It's like you're also helping the tissue to become apart a little bit, and here it is, the more or less a degree of from 45 to 60 degrees of angle, this sliding back and forth movement of the body of the acetons. And here it says 3 to 5 times. You can do it probably 8 times, 10 times, doesn't matter. Okay. And then you do the at the end, before taking the needle out, you do another kind of balancing, but in the horizontal. And then here it's how kind of you fold out, spread a little bit more. It's like if you are intending to open the area which has been compressing the tissue and created this obstruction, this inflammation and pain, of course. So it's like the focus is to liberate, to release, to detach the fibrosis tissue from that affected area, affected structure. It is like that. I was doing that picture, but you will see it, the same thing real quick when I will be doing on the patient itself. So after the procedure, then you have to, if there is bleeding, you will see that sometimes doesn't happen. You have to do the control as you do normally with a gauze, and just press a little bit, and that's it. You never face. I never face a condition where a lot of blood comes out. It's a few drops, little bleeding, as it happens sometimes with acupuncture needles. And then after the finishing of the procedure, usually you will see it. I didn't do it for the neck and for the lower back, but it's very simple. How do you, after you finish, I will describe later on, but you do stretching movements. You, with your fingers, you go along the area where you uh, did the procedure with the Akutamas, you stretch, you kind of do a kind of massage, you pull up, you bend, and you intend to do the movement of the finger, the intend to do the movement of the shoulder, the different movements of the neck, or to help to move and to manipulate a little bit the lower back. And then sometimes, just sometimes, after doing all these maneuvers, you don't need a specific care. Definitely, it's very seldom that you need any specific care for the patient after the treatment. Some very sensitive patients will remain with a little bit of pain after the procedure. You could let them, if they really want to have some anti-inflammatory or analgesic tablet, but most of the times you don't need it. But if it is the case, let the patient have it for 1 or 2 days, and that's it. Don't need more than that. Okay, what happens then? You activate the tissue and activate the repair process, and of course reduce the stress, the mechanical stress, which is blocking and promote the elasticity of the tissue. Of course, it creates a modulation of neuroinflammation and nociceptive pathways. It happens as it happens with acupuncture as well, but here it's a little bit more aggressive, more energetic, and more it's a stronger stimulus. So then what you will expect is the restoration of microcirculation, and of course more a better metabolic exchange, reduced fibrosis, and a better and faster recovery from the affected lesion. So here I will show you some of the techniques that definitely I believe that you could go ahead and with the proper diagnosis and evaluation and exploration, you will use it right away. Of course, it will always be good to have a on-site demonstration with hands-on. Me taking your hand and showing and moving your hand to feel it, to go to the depth, necessary depth, to do the type of movement that you need. Of course, on-site and hands-on demonstrations are always better, but I think this is going to be okay. So I don't think I need to go too much detail. The pictures, they show what they need to show themselves. Of course, you have to palpate that red dot in the hand on the stenosynovitis, which is very, very, very frequent, I believe. It happens in several conditions. It happens in men and women, and when they work with computers and other different conditions. But it happens, and sometimes they don't even do much attention because it does not create too much pain. They just discover that they have this trigger finger, and they are concerned. But sometimes it could be very painful. So you palpate the area, and it not only that you can provoke the pain while you're pressing, but of course you can feel very clearly the area. So you mark it with the Sharpie, and make exactly where you're gonna do the performance of the acupuncture, acutomos technique. So here, how the blade or the side of the blade of the knife goes parallel to the longitudinal axis of the finger, which is following the line of the ligament itself. So you penetrate the skin, continues until you reach the noddle. It's real, very superficial, so it's right away, less than 1 millimeter sometimes. And then once you are there, you can feel it. How the resistance of the different tissue, it's felt immediately. And then you have to not. You don't need to really go and trespass the tendon. You always have the bone as a limit of to how far you have to go, and you can even reach the bone and feel it, how you are already touching it, and then go a little bit backward. But you know that you are inside the nodule, inside the protuberation, the rigidity, the fibrotic tissue, and then there's where you start the procedure that I showed earlier, and you will see it now in the demonstration. Yeah, there is the what I was telling you, that you could use that as well. So it's a little bit more clean. You have a gauze, you have gloves. There is a sterilized acutomus, which is right out of the sterilized package. Those are have to be sterilized, of course. You cannot reuse them. Well, you could reduce them if you sterilize them again, but sometimes they lose a little bit of the sharp. You see how is the mark of the Sharpie, the ligament? Yeah, that's it. I'm gonna start the cutting, pulling up and down, up and down, up and down. You can even go in different angles. Also, I'm doing cutting. If you could see, there is also cutting. It was like anesthesia before. Then after doing this cutting that now I doing the what I described earlier, this vertical moving. It's like opening a little bit, spreading the fibers a little bit more. Yeah, as you see, you can do whatever you feel. I felt that I needed to do a little bit more cutting. I repeated it 2 times, and then do the horizontal folding, and that's it. Yeah, again vertical, again horizontal, and that's it. Yeah, no bleeding. Then here's the posterior maneuvers, as I was describing earlier. Yeah, actually, a drop of blood came out, I think. Yeah, I'm feeling it with my fingers. Actually, you can feel right away that, or if it really disappeared sometimes after only one time, or softened or spread a little bit. And then while you are moving the finger, bending, flexing the finger, you could see you could see that even not only is not painful, of course, because it's anesthesia, but anyway, he can feel that it is possible to move it, and even sometimes just after one time, there is no trigger finger condition again. I generally suggest from 2 to 3 times. I think I have never done more than 3 times for this type of thing. In some cases, the less, only one time was enough. Most of the cases respond after 2 times. Well, they respond right away. From the very first time, it is much better. But then you still have some limitation, a little bit of pain. Still, the trigger finger, it happens, but less often, and it's easier to be released by the patient without doing any a specific maneuver or pressing, because sometimes they have to put the finger back. So they are able to do it much easier with less pain or no pain. But then after the second, it is much better. And usually when you need a third one, is just finish it with it, not more than 3 times. Well, that was for the hand, for the trigger finger condition, the tenosynovitis. And now, well, there are several things in the neck. As you know, if we go and check for the neck pathology, there are different conditions, nuchal ligament and other fascias that are affected, that will be responsible not only for pain in the area, but sometimes even headaches or migraines are related to conditions in the neck. So from different ligament or muscles that connect to that particular area in the back of the neck, on the side of the cervical spine, that you could see all the muscles which are there, the ligaments which are there. You could always do different types of acutomos techniques to treat different neck pathology. But even though you could go up to even a cervical hernia that will create a compression and pain in radiating to the arm and to the fingers. So those are conditions of herniated disc, both in cervical spine and lower back and lumbar spine, are possible to be treated with this technique. So again, the same thing as you've seen before. You examine the painful points. You can even in the neck, it's very common to, while you are exploring the sides of the neck, one to the, not only on the spinous process of the vertebra, but also lateral to that, trying to go to where the lateral processes are there, the ligaments which are inserted there, all the tissue which is there. And when there is this kind of pathology, the soft tissue, the chronic injury of the soft tissue, which would create fibrosis, actually, when you are palpating, you can feel that kind of crepitation. You can feel that kind of a tissue, which is kind of not only thick, but it's also actually, while you press it and move it, you can feel that you're moving a scar. And of course, you many times you will create pain in that region. And even many times you could also hear the sound of a crepitation of that scarring or rigid or fibrotic tissue. Okay, so you usually for the treatment on the neck, of course the patient has to be or sitting or in prone. I many times I've been in sitting, but it depends on the patient and the condition, the age, or whatever. That you could do it both in different ways. So here is again, as you see this lady, the point where I will be using the technique are already marked, which correspond mostly to the, in this kind of patient where I was exploring and feeling. Actually, you could see there is a little bit of a inflammation that comes up a little bit, as you can see it in the picture, and probably while I'm doing the procedure, you will also see it. But it goes more or less at the site of the what we call the jaji, the jaji's cervical point, the these extraordinary points, which are 0.5 away from the midline. And so there is an area where we many times do acupuncture. And actually, for this kind of condition, I do acupuncture with a kind of a deep insertion. Usually it goes like 1.5 soon deep. That means like 4 centimeters deep, and you will probably create with an acupuncture needle also a sensation that irradiates to the shoulder and the arm and the elbow and even through the fingers. So with acupuncture, I would not go that deep, but you will see how deep it is. It's around from three, maybe 2 to 3 centimeters deep. Maybe even in some areas it will go like as far as 4. And as you will see in the technique, how I go and I follow. First, I go very close to the bone, to the vertebral bone, and I'm following near just at the edge of the transverse process of the vertebra. Okay, it's better to see it. I will show. I'm not doing any other protection. You will see I barely touch with my hands. I just go right away to the first point. I, I first inserted following the same the longitudinal direction of the vertebra, and then I rotated very slightly, like maybe 90 degrees, and went through the bone, through the center type. And actually, I'll be touching the vertebra with the I will feel it. I will hit the bone, and there you could also feel the scar tissue, and you will hear the crepitation, but also the patient will experience the irradiating pain. You see how fast? Some sometimes, some people do it, and I also do it sometimes. I leave the acutamus inside for a cup, just 2, 3 acutamus, each acutamus for 1 point. But as you see in this case, I did the 3 points with only one acutamus, and it's no problem. As you could see, there was no bleeding. I thought it has the sound on. I don't know how I put it off, but you could tell when the patient told me, "Oh, yeah, I felt it." And I asked her, "Did you feel it?" And then she said, "Yes, I had the irradiation sensation through the shoulder and up to the hand." It doesn't have to be too severe. It's just very mild. You know you are there. You are relieving some kind of the scar tissue that is being created along the orifice where the nerve is coming out. You don't need to cut the nerve. You just have to liberate it to release the pressure that's being created along that area with the fibrotic tissue. And now for the lumbar region, again, the same thing. As I was explaining earlier, you find for painful points for fibrotic areas where you know that there is compression or there is an herniated disc that you know where is the place going on. So you have to go and do more or less the same procedures I've done on the cervical spine, and it's also very fast. And not only for a patient has not gone to surgery, but as I said, I did this many times for patient that came back after a certain time, even after 1 year of having been performed the surgery for herniated disc, and they continue having pain, and then you have the scar. I think you will be able to see in this patient that I will show today that she had a surgery. And even though this time I did not treat the scar or along the scar, that could be performed as well as I explained earlier, but I went to do a type of manipulation as I will do for the actual herniated disc. So here are you could read it, or I already described this for the cervical thing, but it is I go over a transverse process. It's like downward seeking the inferior border of the transverse process, and then I rotate a little bit and go to hit the bone. Trying It's like you are trying to go as close as possible, are actually to go into the intervertebral foramen. Actually, you could go right there because actually it's right there where most of the fibrosis is occurring. And then it's like you go alongside the nerve and liberate it from the fibrosis, which is around the intervertebral foramen and surrounding the nerve as well. So that's the way you repair. And then even though you don't hit the nerve, you make cut the nerve, but you create this release of obstruction, of tension, of microcirculation affected, create a much faster response to inflammatory process and to promote better circulation to the area. And that itself create a very important therapeutic effect on the region. Okay. Actually, there are some of the points which are marked, which are the areas where she has elicited pain. And with the marks I've done, you could see where are even the verticals L5, L3, L4, L5, and actually, I don't know if you could see it, but in the middle there is a scar for the previous surgery. Yeah, yeah. I already rotated it. First, I showed you that where was the edge of in the acutomosis mark, a flat area where shows you where is the direction of the knife of the flat area where you have to do the cutting, which is alongside. Not you not intend to cut the nerve, but to relieve, to release, to open up, to to break the blockage. See? In this case, I don't know if you saw the length of that ectodermis. It's like almost 10 centimeters long. I think it is 10 centimeters long. 10 centimeters long. So it almost goes like 7 centimeters in. Here, that movement, like cutting, I'm doing. I am feeling the how I'm cutting, how I'm separating the difibrotic tissue. Again, same thing. I'm touching the bone actually. I'm going very close to the interforamen, vertebral foramen, and then the patient said, "Oh, I felt it. I felt it. It ran through my. It's not that painful. Just she felt the sensation. It's like as when you do acupuncture, the same thing happens. So that was it. Okay. Then as I was telling you, it's very safe and effective. There are very minimal risk. I don't remember having any problem. I do know of some, yeah, maybe some kind of numbness in the area, but after you recover function, the movement, there's no pain, uh, no movement limitations. Even if it is a little slight a numbness, some kind of a little paresthesia, it could be accepted because it does not limit anything else. That's the most severe complication that I have seen, if you could consider that a complication. So I never seen any infection, any injury of nerves or vascular or vessels. But of course, it could occur if you don't do it carefully. So you have to be to do the training and to follow that, to know the anatomy and to know where you're going. Okay, final remarks. Uh, as I said, it's a very effective technique. It is intended to the manage of the chronic soft tissue injuries. You could definitely improve quality of life, reduce the pain, and recover the function, the movement. There are very little incidents of complications, as far as I know. At least, at least in my practice, I have not any complications at all. And some of my close friends and colleagues have not had any complications at all. So, and as I was explaining earlier, it has to be a consider an option in our daily practice of the medical acupuncture. We do acupuncture, we do different related techniques. I do fire needle, I do insertion of um, uh, the um, the threads, the I forgot the name now. The threads that we insert in the acupuncture points, the surgical thread, and then we do inject with some herbal products. In Korea, they have a lot of very good products. I've got a lot of extracts of for injection of herbs and different other techniques that are very very welcome and very good to combine. To know when to combine, not to just put a lot of things on one time at the same time. It is not good to do that. It has to be gradually. You have to select the appropriate treatment. And as Marcia was saying, it's not that you're just going to go and do the local thing and that's it. You have to prepare your patient. You have to do the syndromatic, the integral treatment, to do everything, and the emotional, physical, and all the aspects you have to be covered, and you have to have a follow-up with different other techniques. I do acupuncture for these patients. Actually, this lady was treated with acupuncture first, and at the end, I did this acutomus. And as for demonstration or teaching purposes, I avoid certain other things. But as you see, it was very simple. Don't need to a lot of materials. Don't need to a lot of preparation. And actually, there was no bleeding at all. It's not that I was lucky, but it happens most of the times. I think more than 80% of the times there's no bleeding. Okay? So this is it. Thank you. Arigato. Merci. How do you say it in Greece?
Ευχαριστώ.
Yeah, it's written there, but I don't know how to pronounce it. Evgaristo.
Yes.